Premier Gladys Berejiklian has announced a week-long lockdown for the local government areas of City of Sydney, Waverley, Wallara and Randwick. The outbreak in Sydney's eastern suburbs was caused by weaknesses in Australia's hotel quarantine system, but it's now the people of New South Wales who are having to pay for it. Joining the show to discuss this issue and more broadly what's going on with COVID-19 in Australia is leading infectious diseases expert and director of the Doherty Institute, Professor Sharon Lewin. Welcome to the show, Professor.
Pleasure to be here, Nick.
Well, a number of leading infectious disease researchers have been critical of the New South Wales government's decision to wait until today to announce a lockdown of 4 local government areas in Sydney. Given known case numbers from the outbreak of the highly contagious Delta variant have now risen to over 65, do you think the New South Wales government waited too long?
I actually don't think they've waited too long. I don't think there's a magic answer of when we should or shouldn't lock down. We've seen some states lock down very quickly, for example, here in Victoria. And of course, you never know what that prevented, but we're assuming it prevented a much, much bigger outbreak. And there really is no kind of magic number on when to pull the pin on it. It really depends on how their test, trace, isolate system is keeping up with the number of cases and whether your population are compliant with coming towards getting testing. So I'm actually quite supportive of testing other ways of doing this, because otherwise we're locked into recurrent lockdowns, which I just don't think is sustainable to be doing repeatedly over time. I will just say what Sydney are doing is a limited lockdown, which we tried in Melbourne in the second wave last year. You might remember we had 10 postcodes lockdown and it actually didn't work. However, we didn't have great test, trace, isolate systems in place at that time in Victoria. We're in a much different place now, right in Victoria, but Sydney has very good systems in place. So it really depends on how well they're keeping up with the numbers.
So Sharon, is that the key difference? Because as you've correctly said, down here in Victoria, in response to something like the outbreak we've got in Sydney now, we would see the whole state being closed down. Whereas in New South Wales today, Gladys Berejiklian's announced the 4 areas. Are you saying that the difference between Victoria then and Victoria now and New South Wales now is that the contract tracing system is so good in New South Wales and is better in Victoria that doesn't warrant a statewide lockdown? Because if this was a Victorian problem today, historically the Andrews government would call for the whole state to be closed down for a period of time.
Yeah, I don't want to confuse people, because let's just, the lockdown last year in Victoria, I think, was very different because we actually did not have contact tracing in place. We tried these incremental lockdowns, it didn't work, and we had a very large outbreak, something we definitely want to prevent happening again. Situation now in 2021, much more infectious virus, we know that. Very good systems of test, trace, isolate in both New South Wales and Victoria. However, I think both governments have a different level of risk. New South Wales has a lot of confidence in their test, trace, isolate system. They're comfortable in managing larger numbers, and there are ways that you can actually measure how well they're keeping up with those larger numbers. When you allow a bit more community transmission to occur, as we saw in the previous ways the New South Wales government handled the Northern Beaches, we might have a longer tail of this. The advantages of an earlier lockdown is that you bring the whole thing under control much quicker. Now, Victoria's policy, yes, has been a much bigger, and I personally wonder whether that might have been because they were burnt last year with a limited lockdown. So they've gone for a much bigger Melbourne-wide or then Victoria-wide lockdowns.
Professor, if the federal government's vaccine program, the rollout, had been more advanced than it is, could this Sydney lockdown have been avoided?
Absolutely, no doubt that if we have more people vaccinated, we would reduce the risk of rapid community transmission and also reduce the requirement for lockdowns. First of all, anyone that's vaccinated will be prevented from getting severe disease. The results for both Pfizer and AstraZeneca are fantastic. 98% reduction in chance of going to hospital, which is the most important thing. Then vaccines will prevent the chance of just getting COVID by 60 to 80%. And then if you're infected, it reduces transmission by 50%. So all of that slows down the transmission dynamics through a community. Now, to get to herd immunity, to completely cut transmission, we need vaccination rates up about 70 to 80%. But even having 10, 20, 40% of our community vaccinated will affect those transmission dynamics. So yes, vaccination would make a difference. Would it stop a lockdown altogether? Harder to say, because we at the moment in Australia have this zero tolerance for any COVID. Now that, I hope, will change over time, but it can only change with more and more people vaccinated.
Can I just ask you a final question in relation to vaccines? Is there any evidence worldwide that anyone who's had the vaccination has gone on to catch the virus, do you know?
Absolutely. Yes, you can catch the virus if you're vaccinated. So if you're vaccinated, whether it's Pfizer or AstraZeneca, your risk of catching the virus is reduced by 60%, let's just say, for AstraZeneca with the Delta variant, and reduced by 80 to 90% with Pfizer. If you do get infected, the chance of you passing it on is reduced by 50%. And if you do get infected, the chance of you going to hospital is virtually zero if you're vaccinated. So there is huge benefits, even if you were to get infected, in that you would basically limit the chance of hospitalisation. So
what evidence is there that people have died? What evidence is there of people who have died who have had the vaccination?
They're very, very, very unusual that would happen because of the numbers of people. So, for example, in countries like the UK, where you've still got some infection, you've still got some hospitalisation, I understand less than 1% of people that are in hospital with COVID have been vaccinated. So 99% of them have not had a vaccine. Huge benefit on hospitalisation and death. Absolutely incontrovertible. Yes, it was 100% repeated again and again in multiple countries.
Correct.
This is the thing I don't think Australians have fully got their heads around yet, that even when Australia's population is fully vaccinated, we will still have COVID-19 travelling or transmitting through the community. It just will take it from being a disease which kills people, potentially, to something that gives you a dose of the sniffles. But I still think people haven't appreciated yet that we are at some point going to have COVID-19 in our community, and probably pretty widespread. Professor Sharon Lewin, thank you so much for joining us today. Oh, please continue.
No, I was just going to say, absolutely. We'll still have COVID, much lower numbers, and hopefully what we want to do is break the connection between COVID infection and hospitalisation, which we're seeing has happened so effectively in a place like the UK with widespread vaccination.